Hi everyone, welcome back to my YouTube channel, and today we are going to talk about salivary mucocele. So let's start our topic with introduction. A salivary mucocele is a mucus-filled cystic lesion of salivary gland resulting from extravasation or retention of saliva. It is one of the most common lesions of minor salivary glands, especially in the lower lip. Mucocele are usually benign but may cause discomfort, swelling, or functional problems depending on size and location. Definition of mucocele. Salivary mucocele is defined as a localized swelling caused by accumulation of saliva in the tissue due to rupture of salivary duct, that is extravasation type, or ductal obstruction, that is retention type. Etiology of mucocele. Mucocele arise from factors that damage the salivary ducts or alter salivary flow. They include trauma, that is lip biting, accidental injury, or mechanical trauma is the most common cause of extravasation mucocele. Second etiology is obstruction, that is shallow leads, strictures, or ductal stenosis that lead to retention mucosal. Third etiology is minor salivary gland dysfunction, that is repeated minor injury or chronic inflammation. It is rarely associated with systemic diseases. Pathogenesis of a mucocele. First is extravasation mucocele. It is caused by trauma that ruptures a salivary duct. In that case, saliva leak into surrounding connective tissue, and there is a formation of body containing granulation tissue walls without true epithelial lining. Second type is retention mucocele. In this case, there is obstruction of duct because of stone or stricture. Duct dilates as a result, forming a true epithelial lined cyst. Third is the common sites. Common site for salivary mucosas include lower lip, that is most common site. Then the other sites include buccal mucosa, ventral tongue, floor of mouth, and palate. Clinical features: appearance. Salivary mucosal appear as soft, painless, fluctuant swelling that is bluish or translucent in color. Its size may vary from a few millimeter to several centimeter. Symptoms of salivary mucocele. It is usually asymptomatic. Discomfort or interference with mastication or speech is there if it is large. Rapid increase in size occur after trauma followed by partial regression. Third is ranula, that is a mucocele at the floor of the mouth that arises from the sublingual gland. It may be plunging ranula if it extends into the neck, and it presents as a bluish swelling beneath the tongue. Histopathology of salivary mucocele. Extravasation type: in this case, there is mucin pooled in connective tissue surrounded by granulation tissue, and there is no epithelial lining. In case of true retention type, there is true cyst that is lined by ductal epithelium. In both cases, there are chronic inflammatory cells that may be present around the cyst. Diagnosis of salivary mucocele. First is done by clinical examination that includes inspection that shows bluish translucent swelling, palpation that shows soft fluctuant mobilization, and history that represent trauma and recurrent swelling. Then we can do is imaging that may include ultrasound that shows cystic lesion with fluid content, and MRI or CT scan for large granular or deep lesion is done. Differential diagnosis of salivary mucocele include hemangioma or lymphangioma, that are vascular lesions, fibroma or lipoma, salivary gland neoplasm, and epidermoid or dermoid cysts that are present in the floor of the mouth. Management of mucocele. First is conservative approaches that include observation, that is for small mucocele that may spontaneously resolve, and to avoid trauma to that area. Second, we can do is surgical management, that is excision ablation along with the involved minor salivary gland to prevent recurrence. It is care for removal of the entire cyst wall with feeder glands. Then there are other techniques that include marsupialization, that is commonly used for ranula, especially plunging ranulas. We can also do is laser ablation or cryotherapy, that is for small superficial mucoses. Then there is post-operative care in the management of salivary mucocele that include maintaining oral hygiene, avoiding trauma to surgical site, and monitoring for recurrence. Complication of salivary mucocele. First is recurrence if glandular tissue is left behind. Second is infection. Third is scarring at the surgical site. Fourth is discomfort or cosmetic concern if lesion is large. And now let's talk about prognosis of salivary mucocele. It is excellent with complete surgical removal. Recurrence rates are low if the entire affected glandular tissue is excised. Most mucoceles are benign and self-limiting. Conclusion of this lecture video. Salivary mucoceles are benign cystic lesions caused by trauma or obstruction of salivary ducts. It is commonly affecting the lower lips and floor of the mouth. Diagnosis is largely clinical, supported by imaging in deep lesions. There is complete excision of lesion along with associated salivary gland tissue in the treatment of choice to prevent recurrence, and prognosis is excellent. Awareness of this condition is important for dentists and oral surgeons to avoid misdiagnosis and ensure proper management. And this was all about salivary mucocele. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.